The title is Clinical and Ethical Issues in End-Stage Gastrointestinal Dysfunction in Children with Severe Neurological Impairment. You know, if we label it as such, we label it as end-stage gastrointestinal dysfunction, I think it's a call for us as providers to think with families about what disease progression means for their child. And in some situations, the burdens of continuing artificial nutrition and hydration might be so overwhelming that we would have discussions about foregoing artificial nutrition and hydration. And so as part of the talk today, we talked a little bit about some of the clinical features of end-stage gastrointestinal dysfunction, as well as an approach to talking with families about this decision to potentially forego artificial nutrition and hydration. And also had a chance to review some of the ethical, legal, and even religious precedent about foregoing artificial nutrition and hydration in children in particular. Sort of a complex issue, often emotionally charged, but there's a pretty solid ethical and legal precedent that supports us in situations, certainly such as this, to support families in foregoing artificial nutrition and hydration. This is often, very emotionally charged, and there's a lot of societal, cultural, religious beliefs around feeding, around eating, around fluids and nutrition, particularly with regards to children. And so that's something to be aware of and to have to work with families, with other providers about. But I also think that there's some limited data that we can extrapolate from the adult world, but also some small pediatric studies to support that for children, particularly in this situation, the discontinuation of artificial nutrition and hydration can lead to a death that is not thought to have any undue suffering or any undue discomfort. It can actually be a very compassionate thing to do from a symptom perspective. I think that that's some of the takeaways for the presentation are that kids with severe neurological impairment do have refractory feeding intolerance, and this can represent disease progression of their underlying condition, and we should really be thinking about this as an end-stage complication of their disease. And given that we're talking about an end-stage complication, it merits further discussion about the benefits and burdens of therapies that can be offered in this situation. And that's where we talk about potentially foregoing artificial nutrition and hydration in children with severe neurological impairment who are having really refractory feeding intolerance, potentially towards the end of life. This is a very complex topic. There's a lot of, I'm sure, patients, families, providers that have strong opinions about withdrawal of artificial nutrition and hydration in children. And even for families and providers that aren't that feel comfortable with this as a decision plan, this can still be very challenging and very hard for families and for providers. And I think the advice I would give is that this is the time and the opportunity for us as palliative care providers to really use our full interdisciplinary team and resources to help support the children, the family, other providers, and frankly each other during these really complex cases.